I've been looking at the way our healthcare system actually works, and the more I see, the harder it is to believe it's really designed with patients' best interests at heart. On the surface, you'd think the goal is to keep people healthy, prevent illness, and provide effective treatment. But when you start pulling at the threads, it becomes obvious that there's a deeper structure here, one that prioritizes profit over public well-being. From the very beginning, the whole setup feels less like a public service and more like an industry. And in this industry, the customers aren't meant to get better quickly. Think about it. If people stayed healthy, the system wouldn't make money. Instead, the goal seems to be managing illness, not curing it, keeping patients on a lifetime subscription to treatments, medications, and follow-up appointments. It's a business model, and in that business model, a permanently healthy population would be a financial disaster. I've seen how new treatments or medical devices are marketed. There's always this big push: commercials, sponsored studies, expert endorsements. But when you dig into the data, you often find that the studies are funded by the very companies selling the product. And what happens to cheaper, effective, but non-patentable solutions? They vanish into obscurity because they can't generate massive profits. Pharmaceutical companies are a perfect example. These aren't charities. They're corporations accountable to shareholders. Their financial reports openly talk about growth markets for chronic conditions. That means the more people get diagnosed and the longer they stay on medication, the better the stock performs. It's unsettling to realize that the system has a built-in incentive for people to remain unwell. And it's not just the companies. Regulatory agencies, hospitals, insurance providers, they're all tangled in this web. Decisions about treatment aren't always made based on what works best for the patient, but on what's reimbursable, what's billable, and what fits within the guidelines set by those who benefit financially. So when people ask me why I'm skeptical about the official narratives in healthcare, it's because I've seen the alignment of incentives. It's not about conspiracy in the sense of a secret cabal. It's about a system where profit naturally outweighs compassion. And once you understand that, a lot of what seems inexplicable suddenly makes perfect sense. When I look at how medical research operates, the pattern becomes even clearer. The institutions we're told to trust, universities, research hospitals, public health agencies, are often deeply dependent on funding from the very industries they're supposed to regulate. This doesn't always mean the data is outright fabricated, but there's a subtle shaping of outcomes. Trials are designed in ways that are more likely to favor a sponsor's product. Negative results get buried. And once the right conclusions are published, they're amplified through media channels that rarely question their sources. It's not unusual for a drug or medical device to be released with glowing reviews, only for serious side effects to emerge years later. By then, the profits have been made, and any lawsuits are just a calculated business expense. The focus isn't on long-term patient safety. It's on getting a product to market fast enough to secure a patent window and dominate sales before competition appears. Advertising plays a huge role in shaping public perception. In some countries, pharmaceutical ads are everywhere, on TV, online, even in print magazines. They're designed not just to inform, but to create demand. People see an ad, recognize a symptom, and go to their doctor asking for a specific brand name drug. That doctor might be under subtle pressure too, invited to conferences sponsored by the drug maker, given access to perks or research grants. All of this happens under the surface, so it looks like ordinary medical advice, when in reality it's part of a sophisticated marketing pipeline. Then there's the insurance side. In theory, insurance companies should want to keep people healthy. Fewer claims would mean less expense. But in reality, they often dictate which treatments are covered and which aren't, steering patients toward options that are cheaper in the short term, even if they're less effective. Preventive care, lifestyle interventions, or personalized treatments that don't fit the standard billing codes get sidelined. And if you can't pay out of pocket, you're stuck with whatever the system approves for you. Meanwhile, the media feeds us stories that reinforce the idea that the system is working as intended. Breakthrough discoveries are hyped without context, while systemic failures are downplayed or blamed on individual bad actors. The bigger structural issues, the ones baked into the profit model, rarely get airtime. And if someone does raise those concerns, they're often labeled as alarmists or conspiracy theorists, as if pointing out conflicts of interest is some wild idea. To me, the problem isn't that there's one villain pulling all the strings. It's that the incentives are so misaligned that the whole system naturally drifts toward exploitation. Everyone's just doing their job, but their jobs exist inside a framework where the bottom line matters more than human lives. That's the uncomfortable truth nobody in power wants to talk about, because they're all benefiting from keeping things exactly as they are.